last few videos, what I was doing were mostly on the negative aspect of illnesses, mental illnesses, something like narcissistics and the borderline personality disorder, narcissistic personality disorder, and also some other antisocial disorders. And now I am thinking of doing the. I was thinking that if the person get the opposite of those negative personalities, then how successful they are. Especially if we get consider the borderline personality disorder. When I was doing borderline personality disorder very recently, I found if somebody can get away from that each 9 criteria, there are 9 criteria. The person can get there. The ego would have developed a big personality, but the disorder is a disease condition. I'm not thinking about they can develop into a better personality, but they are before they go into disorder or before they go into pathologically mental status, the personalities are there. Sometimes you can change. So what I was thinking is this. I was thinking about myself, and that may be useful for anybody. That when somebody I had myself, I want to tell until my life, till I become a medical doctor, that is successful. After that, my medical life has gone down. After that, I know the reason. I know the reason, but I know the reason why how I became a medical doctor. That's what. So earliest, what's the most important thing I was thinking. Still, I remember that in grade 10, the grade 11 and 12 is the time that we enter into biology and we do medical the biology studies to enter into the medicine. And they are the I was attending to. We have a Wednesday evening club. Wednesday evening club. That is in the Wednesdays evening, some eminent figure, especially the old boy of Richmond, come there and he talk about something. The one day I was watching a person. That person is nicely dressed. That means very clear. He's a white dress, but it is very simple dress. And his trouser, still I remember his trouser, check clothes, and the well ironed. That I can still remember that one. The iron properly. That the line is there. So I was thinking, it's a fair color also. And I was thinking, if I also can become this type of person, what a light in my life. What a light in my life. What a happiness in my life. What a satisfaction that I may develop in my life. What sort of service that I can do from my life. I was thinking a lot. He was Dr. Aryasena Gamage, who died recently of a cancer, but I met him. I just saw him. That's the time that I was very late, maybe about 20-30 years late. I told him, I inspired you. Oh, he said, oh yes, I like God, and say he wanted to support me also. Anyway, he's one person that I created, and later. Still, I can remember some 2 or 3 figures that motivate me to build up a picture of a service person, medical doctor. And one other person is Dr. Namalgamage, heart surgeon. He also became my friend. But when I build up their picture, they were just acquaintance to me. They don't even know about me also. So that Dr. Namal Gamage, somebody, I was going from Kalutara to Galle by bus, and Dr. Namal Gamage was a medical student, the grade second year, and he was just standing, and I look at his figure. He's still, I can remember, brown color, some chocolate color trouser, white color shirt, and I said, oh, what a personality that I see. Then, if he's a medical, no, I cannot become any other student in a university. I also should become it like that. And one other day, another person, he's Dr. Anil Silla, now he's a radiologist, practicing radiology in Sri Lanka, and he got selected to medical school, and he wanted to come and meet my teacher. We had the class that time, that is a animal biology class, and he came to the door and he talked to my teacher and went. Somebody told, he was informing that my zoology teacher that this person is got selected to medical school. He just informed that to the teacher. So I was looking at him. So if I can also become a medical student, what sort of light in me, what sort of satisfaction in me, what sort of service that I can do, what sort of courage with me, but that light is with me. That's what I was thinking. Or the luminous in this. And that's one important thing that I learned. And then other one is I didn't study much, but I was studying anyway. I was having steps to become a medical student those days, and but I think I was in second highest or third highest marks I was getting, not that much. But later at the final, I became the second in this class. But then I was thinking some other studies. But then I wrote to Professor Kalawanseka what are his experience of memory. And there he said about memory, he wrote a small postcard citing memory. And this and that, various things. They use all the senses of the same knowledge should get by various senses. That's what his message. And various senses, and then you are going to get a better memory and attention and something like that. So by that way, I got another one is, I think, some other one told me, I was open my mind for various things. Somebody, my friend told me, one of the professor called his student and asked, what you are doing? Are you studying? How you are studying? He said, oh, I read everything, go home and read everything. No, don't go and read everything. And first, by memory you revise everything at home. And then take the next day only you take the books to your room and then read. Whatever you could not, or whatever you, fill the gaps like that. So what's the important thing is memorizing. So that also came into my mind very hardly. Because people are asking why, what you are doing. So that now I am in the second step. I had a figure of these persons, and then I am on my achievement. And that was very much influence to me, how to study. And then what I was doing is, I was not, some people asking, are you studying? No, I had a childhood problem, that is nasal secretion. 8 p.m. I get this nasal secretion. To overcome that, I get then clofenrolumaleate at that time, and then by 9 I am down. I have to sleep. But in that time, I was very efficiently using my memory. I just go out in my house, and there is a wall-like thing. I can sit there, sit and like this. Still it is there at home. I can show you if I have this thing. And in that one I sleep like thing, and I was memorizing whatever I learn. I just go through. When I feel I don't know, I can't remember, I just remember rest of the things like that. Then I remember what I could not find. Then I remember what I could not. Then I go to room and study that. Like that, then I study again. Like that. The most important thing was that how to memorization. And other one was, I was not a grammar like that. I was analytical thinker. Why is this? Why is this like that? Because that's why my highest score in medicine, the biology subjects we had 4, highest score is in physics. Most of the biology students, they don't get much higher marks in maths. But I got higher marks in maths. Even my chemistry, I scored highest in physical chemistry. Physical chemistry and physics, that's the highest score. And I got A passes. So that this is, other one is, that's what I was saying, analytical. So I have memory skills and also analytical skills. Then I can understand what is this. Then if I understand this, then it is very easy to remember. I don't remember various one by one. It's not this, that Chinese people memorize like that, no? Without understanding, without analyzing, without argument. I can't do that. So I did that. And then the other one was my people. The third one is my people surrounding me. And fourth one is I was very helpful. When I go to my class, every day 3 or 4 people are behind me waiting, line up to ask me how to do this, how to do that, how to do these various things. They could not understand how I can. So I was very helpful to them. But I had no much of a friendship with all the people that much. That's very important. Friendship and going to see bath, going to ramparts, or going to some various areas and wasting my time. No, my ambition was to become a medical student, so that I have to pass my A-level very much best. I became number 8, I think, in the southern area, so that Ogol district. Then my ambition was that, so that anything coming into my mind to deviate me from my time or wasting my time, I didn't go into that. I was doing swimming, I was doing scouting, I was doing first aid, I was doing some other general knowledge. I was on those teams. I get closer to the first class scout and first aid and the swimming also. But I gave up everything. That's the very important thing too. And also I was reading about various philosophies, especially this socialism. Then I gave it up fully. Then I was reading novels. I gave it up fully. Until I finished my MBBS, I never touched a single book, single novel, single extracurricular books. Only I read only about medical books. That's what because my target is that I don't want to deviate from that. So I knew if I read certain various other topics, I am going to deviate. If I go into friends, then it's going to deviate. And if I go into these various philosophies and communism and Marx-Leninism, then it is going to deviate. So that I didn't deviate. And other important thing is my mother and father. Father was not obstructing me when I was just in that like thing in the outside with the breeze or blow with the wind. Father never asked, what you are doing there? Go and do your studies in the room. No, he never. He knew these people may be doing something. Why should I inquire? It may disturb. He was a education psychologist. He did his diploma in education psychology after his BA, so that he may be knowing his sense, but he didn't disturb. But I can remember one day my mother was telling to my father, he get some marks to enter into science. Let him. Then my father said, no. If he want to become a medical student, let him be a medical student. So that I was doing my second Sh also. I got a very good marks in second Sh. None other, my classmates could not get, all dropped, but only I got higher marks in my second Sh. But I didn't want to. The second Sh, from the first Sh I got selected. I became doctor. And these are very important aspects that I was telling about 5 points. Thank you very much for watching.